You've heard me talk a lot about medical marijuana over the past few years, the potential benefits of it, and also the obstacles to doing more research. Well, as we investigated this, we found that there's another group of outlawed drugs out there that are also generating new interest among a growing number of doctors. Now, some of these drugs include things like MDMA, also known as ecstasy, also LSD. Take a look.
Do you find any difference between one half of your body as opposed to the other half?
Well, I have a sort of a wavering tendency. I don't know which half is trying to get into the other half.
Almost from the day of its discovery, psychiatrists have been fascinated by the properties of LSD and similar drugs, often called psychedelics. It means mind manifesting.
Here is a group of normal soldiers responding correctly to a series of routine drill commands. After receiving a small dose of LSD, they're confused and undisciplined.
Some so-called research didn't deserve the name. It was totally irresponsible, like the U.S. military's efforts in the 1950s. They tested LSD as a potential weapon. But the interest in these drugs didn't stay in the lab, and they trickled onto the black market and were soon outlawed. The pattern repeated itself with MDMA in the 1980s, which had picked up the nickname ecstasy. Therapists tried it with patients. Millions tried it on their own. And in 1985, it was banned under federal law.
MDMA, like MDA, would cause permanent or long-term brain damage in users.
But over the last decade, a small band of researchers wrangled permission to try again, this time giving MDMA during therapy sessions with patients who were suffering post-traumatic stress.
I'm just going, wow, I can't believe I have this in my head. I can't believe it's in me.
It's not that people just had a blissed out experience, felt great about the world, and they were cured. But a lot of the time it was revisiting the trauma. It was painful, difficult experience, but the MDMA seemed to make it possible for them to do it effectively.
Dr. Mithoefer has treated nearly 50 patients in his studies, and he's currently working with veterans as well. We're going to talk about that. The medical world is taking note of this, and now there's a growing body of research on psychedelic drugs, and not just MDMA. There's a fascinating story behind this, and a lot of it can be traced back to a small group of, I would say, unlikely characters. One of them is here with me now, Rick Doblin. He runs the Multidisciplinary Association for Psychedelic Research. Also here is Tom Schroeder, who lays it all out in this great book. It's called Acid Test. Welcome to both of you for joining.
Yeah,
thank you.
Thank you, Sanjay.
Rick, you know, it's interesting, and I read the book. It's a terrific book. We'll talk about that. MDMA with post-traumatic stress, like we just saw, what do you think is happening there? Do you have an idea what the mechanism or how you would describe what's happening in the brain?
Yeah, MDMA reduces activity in the amygdala, where fear is processed, and it increases activity in the frontal cortex, where people put things in association and context. So people are able to look at traumatic memories, the fear is reduced, and then they're able to separate out that it was happening then and not now, and then they don't have to be triggered so much when they have the memories.
And so if they're going through counseling, for example, it could make that counseling more effective. They're not as paralyzed, if you will, by the memories that are being brought up?
Yeah, we're saying that MDMA itself is not the medicine, it's MDMA-assisted psychotherapy.
And there is other research, right? I mean, as much as we're talking about this, historical research, including some of it done in the Army, as we saw there in the clip we just watched, some of it's crazy. To watch some of that footage, it just looks nuts. But did we learn something from that that we're now applying?
Absolutely. I mean, from the time that Albert Hofmann discovered LSD and started sending it around to labs around the world, it became the most studied psychoactive drugs in history. And it was considered to be extraordinarily promising. You know, I think one study in the 50s called it of utmost value to psychotherapy. And thousands of people were treated this way, and they were getting astoundingly great results. And then the cultural thing happened in the 60s, where it got out into the, and became a drug of abuse. And not only that, but there was something about the nature of the psychedelic experience that really scared Western rationalist culture. And there was a tremendous overreaction and a stigma attached to that drug. You know, Nixon famously called Tim Leary the most dangerous man in America. And that was ludicrous, of course.
I know, Rick, you've been doing this for a long time. Do you have worries? Do you have concerns, dangers that you think, really, some people can go both ways on this. Some people can underplay the dangers, some people can overplay it. What are the dangers?
Well, there's a different set of dangers when this is used in clinical research setting than when people use these drugs in non-medical recreational settings. But in the clinical settings, the dangers are mostly psychological. They're not physiological. We are able to screen people that have heart problems. We're able to administer pure drugs with adequate fluids, and people are resting. So we've not really found any physiological dangers from administering MDMA or LSD, or other people have administered psilocybin in clinical settings. It's more psychological, managing the fact that people's unconscious emerges, particularly people who've been traumatized. They need a lot of support, both during the experience and then afterwards. We call everybody on the phone every day for a week just to check in with them. We have weekly non-drug psychotherapy between the MDMA sessions, which occur 3 to 5 weeks apart. We track people 2 months and up to a year after their treatment. So I think that from the FDA's risk analysis perspective, that the benefits outweigh the risks.
Look, facts matter, and I thank you both for presenting those facts. Thanks for being here. We'll keep on it.
Thank you for helping us present them.
Sure.